My name is Dr. Joe Allotey. I'm a senior house officer at the Greater Accra Regional Hospital in Accra, Ghana. I was a beneficiary of the Merck Hypertension Award, which was a postgraduate diploma in Preventive Cardiovascular Medicine. It was an online degree awarded from the University of South Wales. I found the program to be a very exciting learning experience. It exposed me to the current advances in cardiovascular care, and also it exposed me to ongoing research in the field of cardiovascular medicine. I stumbled across a poster in my university, in the University of Ghana School of Medicine and Dentistry, which was a Merck Foundation call for concept paper, and the award for the competition was a postgraduate diploma in either diabetes or preventive cardiovascular medicine. And I took up the opportunity to write my concept paper. Fortunately, I was selected as one of the winners for the awards in year 2016, and the same year I started my postgraduate diploma. I can never forget the day I got the email from Dr. Rasha saying that I was one of the winners of the postgraduate diploma. At first, it was disbelief, but I read the email several times and I was very excited when I realized that indeed I had been selected as one of the winners. We tend to see cardiovascular disease as a condition of the West, but this education I received from the diploma has enabled me to realize the epidemiology of cardiovascular diseases and how it significantly affects lower and middle income parts of the world. And for this reason, I have become more exposed to preventative measures that can be put in place to reduce the increasing burden of cardiovascular disease and also to enable people to live a healthier life in this part of the world. My patients have benefited significantly from my education with a diploma in preventive cardiovascular medicine. One way in which this has happened is that I would say that assessment of cardiovascular risk in patients who are being treated for hypertension or diabetes or any other cardiovascular risk factor is not something that is routinely done in many internal medicine clinics across this part of the world. However, I personally have made it a point to assess cardiovascular risk where appropriate in my patients, and this helps to enable the patient realize where they stand and how they can take measures to improve their cardiovascular health. My other colleagues are aware of my postgraduate education and they're very impressed with my approach towards patient care. I recall after I won the 2016 Merck Hypertension Award, many of my colleagues also applied for the competition, and I was fortunate to have been selected as one of the winners. And ever since then, every year when the call for the concept paper comes out, I make it a point to make sure that every single colleague of mine, especially those who are in the final year in medical school, also gets the opportunity to apply in order to improve their chances of winning this prestigious award. And I would say that if every medical professional has an opportunity to partake in this course at some level, I think it would be much better for the entire health system. To Merck Foundation, I would like to say I am extremely grateful for this opportunity to partake in this postgraduate program. It really has been a once-in-a-lifetime experience, and the learning I have received and the opportunity to connect with professionals across the world. I would like to say a very big thank you to Merck Foundation, Dr. Rasha, and all the other staff at the foundation who have been supportive all the way through from the moment I was called as one of the winners up to this very moment.